That light is blinding. Gosh. There we go. Still blinding, but less there. Awesome. We're live on here. Live on YouTube as well. Let's just double check. Awesome. Guys, I'm going to kick off today's live session talking about how you are going to go about healing a herniated or bulging disc. And one of the most important parts of healing this disc is acknowledging the fact that as you start to go through a healing process, your pain is going to drop down much faster than the healing process is going to take place. And by the way, guys, if you've got any questions, any comments, you can always post them in the live session as we're doing this now, or if you're watching this after the fact over on YouTube. So this is the most important thing for people to understand, because how many times, maybe some of you guys watching this, have you been through that scenario where you've thought you flared your back up and then you feel like you're feeling okay, and then all of a sudden like you move again and you're like, oh, I thought I was better because I haven't had any back pain for 2 days, and then boom, it's a lot worse. Maybe the sciatica is going down the leg or something like that. And this is fundamentally because with the lower back, you guys can't see it, and so often we go on, oh, well, how do I know when my back's healed? How do I know when I'm feeling better again? And all these other kind of things. So we go on how we feel rather than the actual healing that's taking place. And when we've injured our lower back, when we have these herniated discs down here, we have injured essentially the annulus fibrosus. That is the part of our back that actually is doing the load bearing. When we squash down, it is the annulus fibrosus that is resisting the nucleus in the middle here from trying to expand out to the sides. And so it is the strength of that annulus fibrosus that has to be restored. And that takes a long period of time. We're not talking about days and weeks. And so we have to understand and appreciate that in the time period that healing process is taking place, we're going to often find that actually we're not necessarily feeling quite so bad. We might well have flare-ups from moment to moment. And Scott's asked in here, he said, how can a person heal 4 bulging discs and an L5-S1 disc protrusion? The fact that we've got 4 bulging discs that have been highlighted probably on the MRI, so I would suspect it's probably something like, we've got bulging discs, we've got the L5-S1 is the worst, and then we've got 4, 5, 3, 4, and 2, 3 that are all involved as well in some shape or form. And that immediately sends off signals that really we've got a lot of things that we're doing every single day that are making our back worse. Just think, for those of you guys watching this right now, while you're on your phones, most likely, that you're probably sat like this. Something like this. What am I doing here? I'm squashing down through the entirety of the lumbar spine with the effect most profound at L5-S1. And so, without a shadow of a doubt, when it comes to healing these things, the biggest reason that so many of you guys struggle for extended periods is the things that you're doing every single day that are getting in the way of the recovery process, the healing process, the strengthening process. That's the most important thing. And that's when you start doing the spine stability exercises that we talk about, things like the squat, the hip hinge, the dead bug, the marching bridge, those kind of exercises to restore strength and stability. You're not just doing them while you're actually working out, but they have spillover benefit into what you're doing every single day. You're more aware. You're not slouching like that. You're readjusting yourself. You're holding yourself a bit more effectively so that you're not constantly focusing, strain, squashing down on the front part of this disc here and driving that nucleus back into, like in the case of the disc bulge here, into those remaining layers of annulus that are weakened and trying to recover. In order to start getting better, we have to stop making ourselves worse. And so starting to learn to control the spine is the essential part. And then building on from there, we're doing our rehabilitation work. It's the same exercises. It's building on the squats, the hip hinges, the step-ups, all of those kind of things to rebuild the strength and tolerance. And then steadily doing that with the addition of loads, like you guys can see behind me, to start to test the load tolerance of those discs as they go through that strengthening process. So great question from Scott, and quite frankly, that's the question everybody's got on their minds when they've got a bad back. How do I go about actually healing this thing? Just looking at a couple of comments that are coming in on TikTok, and then I'll jump over to YouTube. I can see Armin's posted something as well. I have severe back pain after I twisted and injured my lower back. MRI is clear, but I'm in agony 24/7. Ash has commented on TikTok. It's absolutely fantastic, I would argue, although it can be very deflating. If you have an MRI, you've got tremendous low back pain, you quite clearly did it after a mechanical thing, right? You went down, you fixed something up, you go, oh, my back, right? And then you go and have an MRI, maybe because you're proactive, let's say. Like, for example, I injured my knee training for jiu-jitsu back in June, and I was proactive. Within the week, I'd got an MRI on my knee. And now I very well could have, they could have come back and said, no, there's nothing really wrong here. Fantastic. I don't have significant and substantial knee damage. However, that doesn't mean I can't manage that injury really badly to the point where it's really bothering me. So if we get these findings back where they say, do you know what, there's nothing significant there, but we do have some minor issues, but that shouldn't be causing you as much pain, that's a value judgment from the practitioner, and they can be wrong in that value judgment. You have an injury, thank goodness that it's not more severe, it's not a raging disc herniation. Now go about the rehabilitation work. But very important, the phrase, the MRI is all clear, that is a clinical judgment. I argue, kind of tongue-in-cheek a little bit, but an MRI is only ever clear if the person didn't actually bring up the MRI, right? There's stuff to talk about on more or less all MRIs. And so clear or normal. Sometimes normal is a shortened version of normal age-related wear and tear, which means there is stuff to talk about, but that person is making the judgment that they don't think it's relevant. And they could be wrong in that sort of scenario. And if you pretend it is relevant and then act accordingly, you'll often find that all of a sudden you're doing an awful lot better. Just a note, guys, on the comments and questions, please do focus them around lower back issues, right? That's the main area that I can really be of helpful for you guys. I will say, though, fundamentally, if you're talking about cervical issues, that's the neck. A lot of the principles, a significant number of the principles that we talk about are going to be have crossover and be very relevant to the neck as well as the lower back. Armin said on YouTube here, he said, I'm 3 months in from an injury to L4-5 herniation. And I've got DDD. I think those kind of things are maybe just saying the same thing fundamentally, because we've got degradation of the disc health if we've got a herniation or a bulge. How do you know the difference between re-injury and a flare-up from certain movements? Am I resetting the healing clock? Fundamentally, when you have a flare-up, it is the same, right? It's like picking the scab. You're creating some minor tissue damage to the tissues that are trying to go about the healing process. The best thing you want to evaluate is how significant was were the actual forces at play to give me a cue as to whether actually that might have caused a bit more damage. At the end of the day, like, what if it was more severe? What if it wasn't more severe? Are you going to do anything from a rehabilitation point of view? So long as you don't have, or rather, let me rephrase this. The most important thing for you guys with your lower back injuries to understand is you want to be very aware, not obsessive over, but aware of what the emergency symptoms are, the cauda-equina symptoms are. And also know that they are extremely rare, extremely rare. So more or less all of you are not going to have this, but know what they are, so you know that you can act accordingly as appropriate. So that is the saddle anesthesia. That's the loss of bladder and bowel control. We've had a significant trauma associated with a sudden onset of this pain. Then you go straight down, right? You go to your hospital, you get them checked out, and you tell them about those sort of cauda-equina symptoms. But assuming we don't have that, if you have a flare-up, if you have a more severe flare-up, a more minor flare-up, you carry on with the process. And that uncertainty is completely natural and normal, and that's one of the reasons why we have so much in the way of support for members going through the program. Because the simple fact of the matter is, it's most of the time not your rehab work that actually leads to the re-injury of your lower back. It's actually more so the stuff that you've done every day, right? You're walking the dog and it pulled you in a funny direction because it was chasing a squirrel, right? It's not actually you being 100% focused on your exercises. It's the other stuff. And so we just have to carry on, because daily life is invariably more strenuous, more risky than what you guys are doing in your careful rehabilitation work. And if you need more guidance and help and support on that kind of stuff, just check out the link in the profile page if you're over on TikTok, or head over to the website if you're over on YouTube. And just for convenience, before I go through some more of the comments, I'll just add a little link in the chat on YouTube. Back in shape. One that you can hopefully click. There we go. There we go. A couple more questions coming in on YouTube here. Hanzo said, I got an inversion table from Mastercare. Guys, any of you guys that have an inversion table, if you want a tutorial on how to use them safely and effectively, send us a DM. or post, because there is a full video on the YouTube channel and on the website on how to use these things correctly. Using them correctly makes a world of difference. Using them badly is not going to be successful for you. He said the back plate is on rollers, so it only needs to lay it 15 degrees backwards for it to be effective. What do you think about this device? I don't know about that specific device. To be honest, the ones that we used was the teeter table, the mid-range model. The biggest thing you want to appreciate with your inversion tables, if you're using them for your disc bulges, or your herniation or your sciatica, whatever it may be, is that number one, on the actual thing that you lock your feet in with, you want to have a long arm. It's no good having to finish decompression. Look at what I'm doing to my lower back to unlock my feet. That is not a smart move. So you've done your inversion, it's been great, it's decompressed your spine, and then you have to fold over like a prawn to go and unlock yourself. Not a good idea. So the most important thing I would argue is that lever, that it's a long lever, so you can effectively unlock yourself after you finish the treatment. And you can use it regularly, as we discuss in the YouTube video. I would go and watch that straight after this, Hanzo, or at least bookmark it or something like that. That'll be really helpful for you guys. Hello from Thailand on YouTube. It's awesome. Just going over to some of the TikTok questions. What else have we got coming in here? And guys, if you guys have any questions, you can always post them in the comments. I'm going to do my best. I'm going to be here for an hour. So I'm going to do my best to get through as many as possible of these, but naturally there are quite a few of them coming in. Okay. So we've got, I had bad pain, been given physio, no scan offered, can hardly walk. Should I do stretches? Stretches are often what people are gravitating to when they have lower back injury, and you need to focus on providing stability to your spine. It is the strengthening process that is so important. Following on from that, Glow has said, I've been doing core 5, the sciatica is less, but the pain has moved upwards into the lower back. Is that a good sign? So the core 5 specifically are exercises where you are stabilizing your spine. You are holding the spine steady and it is not moving. One of the reasons that these are very, very good is because if you do them wrong, you're going to experience pain. So don't do them wrong is the answer, right? So it gives you that extra guidance. The pain actually can be a really good marker because you fundamentally get the flare-ups when you move in a way that aggravates the injury. If you are holding your spine still, you cannot strain the injury fundamentally. Now there are slight exceptions, right? For example, if you stood with your spine steady and someone piled a bunch of books on your hand, then there's a compression, so that's still moving, right? If you're doing them effectively, you're not going to be straining the issues. Now with sciatica specifically, it is very common to get the process called centralization. And that is not to be confused with central sensitization, which is something different. Centralization is where the pain in your leg, going down the leg, right, that starts to recede up, and then we are left with lower back pain, and that goes last. That is something that quite a number, I would say the majority, not everybody, the majority, will notice as their back injury is going through a resolution. And most of the people in the inverse will notice that their back pain first started off as back aching and soreness and that kind of stuff, and then they had that extra relapse, that extra flare-up, that extra incident, and boom, now it's going down the leg. And that's really bad, as in it's very painful. So you see that reverse of that process taking place, which is very, very common. Hanzo said, using the table to get relief and then walk to push fluids into the spine, also doing calf raises to pump blood. Hanzo, you're much better off. Use the table after doing proper spine stability exercises, and then you're going to build some element of strength and stability back into the spine. That I always put something like the inversion table, the towel decompression, the bed decompression exercise, all mechanisms for unloading the lumbar spine. I put them at the end of the protocols that you're doing. That's what we talk about with our members in the program. What else have we got? Patricia Lamb, lower backache with a tight pulling into the right buttock. Guys, if you're watching this live online right now, like just post your symptoms. Like post like what level you've got, like L5S1 or a lower lumbar injury. You don't need to be descriptive. And then like the symptoms, because what you'll find when we've done, like I've been doing these for so many of these, right? More or less everybody in the chat has an L5S1 or L45 injury as the primary area that is problematic, right? Because more or less all, like literally 90% of lower back injuries are the lower lumbar spine. It's this one I'm pointing to here, and the last one between the green and the orange. You all have the same fundamental injuries at their root. There will be nuance and difference from one person to the next, but most of you at that segment is the injury. But you will then notice that lots of you have very different symptoms as it goes through, that we experience on a day-to-day basis. One of you can walk, the other one can't. One of you can sit down, the other one that's painful. But you've all got the same injury. And this is why it's so confusing for back pain, because you'll see 101 different like hacks and tricks to do this, that, and the other. But they're all short-term. Whereas if you all just focus on rebuilding strength and stability, like through the exercises that we talk about and that we do with our members in the program, then you find that it simplifies, it reduces the noise, because the noise is there with these gimmicky little movements that you do, like the sciatic flossing, for example. Or if you bend to the side and stretch your leg and cross this one over and then go like that, all of a sudden your sciatic pain will go. Or if you bend over the side of the sofa, and like, they're all little hacks to just play around. All they're doing most of the time is just playing around with the size of this hole. And that's it. It's not doing any healing. Healing doesn't happen, and you guys instinctively know this, I think. Healing doesn't happen in a moment, especially in the tissues that are injured. Healing takes time. We have to rebuild that healing, or support that healing process as we're rebuilding strength and stability into the back. Question on YouTube here. On the core 5, should I follow the sequence or can I start with any of the exercises? One of the ways in which we structure the routines for members in the program is that we always put exercises like the dead bug and the marching bridge first, because you're on the floor when you're doing those. And so people say, well, should I do a warm-up before my exercises? It's like, yeah, well, no, because in the early stages of recovery, a warm-up might be walking, and walking is more strenuous than lying on the back doing a very simple version of the dead bug, for example. And so why would you warm up with something that's more strenuous than what you're going to get into? So you just go through them, right? You just start with the floor-based ones, the easier ones. Maybe you do them on the bed, for example, and then you build up through those. You'll notice how the order that we talk about them, dead bug, marching bridge, squat, hip hinge, step up, that order gradually gets greater levels of complexity, greater levels of difficulty. Generally speaking, people can manage the earlier ones more effectively, and the latter ones are more of a challenge. So that's kind of the way to go. Hanzo, if you're looking for actual, a full-on program and structure, because it's not just about exercises, right? I would say we recently did a poll, a survey monkey of our members to get some idea, and more or less everybody has heard of a squat. Everybody's heard of a dead bug, a marching bridge. Like, these are not new exercises. They're not magic exercises, although often we gravitate to try and find something that's special, this secret thing for recovering my back pain. But they don't really exist, those things. But the problem is people don't do the basics correctly. So when we are doing, for example, the dead bug, so many of you, and I'll show you guys, so many of you, let me just turn TikTok around. So many of you will have been shown, when you do something like a dead bug, to lie on your back and tuck your pelvis, imprint your back to the ground, and then do the dead bug. This is an inappropriate movement. You should not be doing that. Because the reason that we're doing the floor-based exercises is to learn how to engage our spine in a very low risk, low cost of error environment. And if you're learning so that you can apply the skill on the floor to the real world. Our exercises aren't just things that we do once and then forget about. We're learning to engage our core and provide stability to the spine effectively. That's in a way that actually saves us on a daily basis from the stresses and strain of daily life. So it's no good if you're doing something that involves you flattening the spine to the ground. This is incorrect, because for the most efficient mechanism for load bearing, if I line up with you guys, you can see the center of the lumbar spine is over the hip socket, right? Just line up for YouTube and for TikTok here, right? If I'm doing a pelvic tilt, I am now not in alignment. This is not aligned, okay? My hip is now miles forwards. If you try and over-exaggerate this, you'll feel how it really is not a comfortable position to be in. It's not an efficient position to be in. While it might feel nice for some of you guys, the reason that feels nice is because all you're doing is when you do the pelvic tilt, pelvic tuck, you're just rounding and flattening that area out to make these holes larger. And that's because there's inflammation around those injuries. And when you increase the size of the hole, it makes it feel better because it decreases the relative pressure in that specific area. And so some of you guys will be forgiven in this moment because we get the comments all the time about thinking, so you're saying I can never bend my spine again? It's like, no, but you can't bend it right now. Hold it steady. You guys have seen many times on this video, I'm rounding and bending all over the place. It's not ideal. It's better if you've got better habits. But the spine is built to bend, but you have an injury right now. So focusing on trying to bend and twist and do knee hugs and child's pose, the many things that many of you guys are doing, will be doing, that's not a smart move. We have to focus on stability. Some more comments on TikTok. You guys always throw so many comments at me. It's awesome. And guys on YouTube, if you've got any more questions, please do post. Tammy has said, I've got pain in the lower back, tightness pulling into the right buttocks, plus burning through the entire right leg, painful big toe. Like, these symptoms are symptoms of your lower back pain, or your lower back injury, sorry. And if we start focusing on recovering from the injury, we'll find the pain will subside as a result. Colin, for him, he's found walking is definitely more strenuous. Someone else might find walking actually is really relieving. What other questions have we got? Andreas, 3 months of back pain, sciatica, done different exercises, nothing is better, visited several physios. One of the mistakes that many people will make is we try and put out a lot of information to help you guys understand what you're doing and why you're doing it. That's really, really important. But people often expect stretching outcomes from strengthening exercises. So when you're trying to recover, if you go into the physio, often they want to make you feel better there and then, right? Because that's how you're judged. That's whether you're going to come back or not, so often. Anyway. And so they'll try and get you doing some stretches, and those are kind of really, quite frankly, the hacks. Right? They might be doing some treatments and other bits and pieces as well, but they're trying to get you to feel better there and then. And we quite clearly know, very clearly, like if you came to see us at the clinic here, we've got the big decompression table in the room behind me, we've got the laser over there. Even though you might feel better after the session, which frequently people do, you have not healed. I repeat, you have not healed. It might have started a little bit, but healing doesn't take place that fast, even with some of the great tech that we've got, let alone if they're just doing hands-on work, right? And so people expect, like when you do a hamstring stretch, you finish the stretch and you have more mobility. The parameter that you have tried to improve, like that, it's better, right? It's maybe not as good as it could be, certainly not, but it's better than it was. Whereas when you guys are learning exercises to stabilize your spine, your chances are 9 times out of 10, and maybe 99 out of 100, you're actually not very good at that skill. You cannot control this lumbar spine, which is why the flare-ups keep happening on a daily basis. And so in the process of learning how to perform the squat, you're going to make mistakes, which means you're probably going to create some aggravation as you're doing that, which is one of the reasons that we pair strengthening work, rehab work, with relief-based work, because the relief-based work recognizes the reality that not only are you going to be aggravating your back on a daily basis in the real world, but also when you're learning exercises that are essential for you to get better, you're probably going to make some mistakes as well. And so you actually might well feel a little bit sore after you've tried your exercises. Now, hopefully that soreness has come with the benefit of learning something, of going, do you know what? When I perform my squat, as I go down, I shouldn't actually do this because it hurts every time. Or because it's wrong, like that's incorrect, and that's one of the reasons why I'm struggling. So I should actually perform with, oh great, I can do it right now. But in order to get to doing it correctly, I had to do it wrong. Because I didn't get it right first time, because if I could have, I probably wouldn't be here, right? I'd be doing some other stuff. And then to actually make the exercises effective, you have to make progress on them. And this takes time as well. So for some of you guys, you'll learn how to perform exercises like the core 5, dead bug, marching bridge, squat, hip hinge, and step up. You'll learn them very, very quickly. But for others of you, it's going to take you a lot longer. And then we have to compare what kind of load are you using on those exercises, right? So for me, for example, I might be using a 5 kilo weight on a hip hinge. So I might be doing a hip hinge with a little 5 kilo dumbbell over here. I'm holding the dumbbell and I'm doing a hip hinge like so, and it's 5 kilos, right? But I weigh 95 kilos. So as soon as I sit back down, I've got an extra 20 kilos of load on my spine. So is it any wonder that my rehab has not reached the point where it's going to be actually making significant change in my day-to-day existence? Not really. But as you make more progress through the process of rehabilitating and strengthening your spine, you will find you start to notice the pain is less. For example, with Colin's comment about walking, you can walk further before you get pain. You can sit for longer before you get pain. You will notice that sciatica is not as bad. That comes from making progress through the process of your rehabilitation work. Not just because a certain amount of time has gone by, 3 months, 3 years or more. Owen said on YouTube here, my symptoms from my disc, L5S1, are more painful radiating to the upper back. Are there specific exercises to eliminate the upper back pains? Often, so lumbar spine issues do not radiate up the back. However, when we start doing work to stabilize ourselves, we start doing some of our rehabilitation exercises, we start holding ourselves more effectively, or if we're holding ourselves badly because we've got what's called an antalgic posture, which is where we're leaning to one side or the other or forwards or whatever because of the pain, we often will put mechanical strain on other areas such as the upper back. And so it's not uncommon for people to have discomfort in those regions, but that's generally a knock-on effect of the injury in the lower back. For example, if I sprained my left ankle, going over on my left, I went over on my left ankle, now I have ankle pain. I can't put weight on my left leg. So what do? I lift this leg up and I limp, like so. Well, what's going to happen is my left hip flexor is going to get tight. That's not a referral from my ankle, but it is a consequence of the injury down there. And that's the same thing up here. I had a comment on the TikTok earlier today. Someone said, I've got radiating pain in my arms. Is that my sciatica? It's like, that's not sciatica. Those things aren't linked. That's not to say there might be something else going on. It's not unreasonable at all to suggest that you might have a lower back injury and something else going on elsewhere. That at all is not beyond the pale. So something to consider there as well for you guys. But again, if we focus on the injury, we have a diagnosis. We've got a mild disc injury at L5S1. Focus on rehabilitating the disc injury down there. And it takes time. But if you focus on doing the work and making progress through there, then you can evaluate and see if there are other things that need clearing up afterwards. John Joe said, what are your thoughts on dry needling? So one of the most important things you guys need to understand when you have any treatment is precisely what it is supposed to be doing for you. Now, I don't do dry needling. It's not my bag. But I could hazard a guess or an informed and educated opinion on what it might be doing and why it might be doing that. So the purpose of the dry needling might well be to try and elicit a reaction, a calming of the muscular system where we're poking the needles, right? So if you've got a bit of soreness in the hamstrings as a result of that lower back pain, that's clearly not going to be helpful. Like, for all the bashing of stretching, it's worthwhile doing, but you have to understand what it is doing. So when we're having the dry needling, generally speaking, you're going to be led flat on the couch. So you're not conceivably doing anything in the process of having the dry needling on your hamstring, for example, or on your back muscles. You're not doing anything that we could suggest is going to be bad for the lower back. It's not helping the healing directly, but if it helps relax your hamstrings a little bit more to the point where they're not pulling on your lower back, that could have a second order positive consequence in terms of the recovery process. So combined with some of the other things, that would be a relief-based practice, leveraging a treatment that can help make life easier for your lower back to go through that recovery process. Hopefully that makes a little bit of sense. Tom has said, I have a disc protrusion. I've had it for 20 years now, I'm assuming, if I'm reading that correctly. 3, 4, 4, 5, so that's these lower sections of the lumbar spine down here. Twisted my back at least twice a year. When we've got these cases where we've got back pain going on for such a long period of time or recurrent injuries to the same segments of the lumbar spine, it's always worth really having an honest look at what sort of rehabilitation and strengthening work are we really doing. Because so often, we forget about our back problem between these episodes, which means we forget about doing anything to rebuild the health of our back. And so, like I was saying at the very start of today's live, you injure your disc, you get an L5S1 herniation, right, or bulge, or minor strain. And beyond that initial strain, much of the pain that you experience is when you're aggravating it, you're getting inflammation building up in these little holes here. And so once that settles down, which generally speaking, if we can be a bit smart, will settle down relatively quickly, we then forget about our back. And if we're not inclined to go to the gym regularly or do rehabilitation or strengthening work regularly, then our rehab work stops and our building resilience stops. And then we just end up not really healing or recovering effectively or rebuilding strength effectively. So it's just one injury on top of another poorly recovered injury on top of another poorly recovered re-injury over and over and over again. Tom said, I just started doing your core 5 and stretches. How many times should I do them per week? With the core 5, so with any of your rehabilitation work, if we think we've got relief-based work, which is what we talk about in the program, got relief-based work over here, and we've got strengthening work, which is our rehabilitation and strengthening stuff. That's the stuff that actually gets us better, right? When you are, this is the important, right? Because when you get given that sheet of exercises by your NHS physio, or you go to the GP, or they go on, just do these exercises at home. That is not a program. That's just a shopping list, right? It's useless. It really is useless. Because how you do the exercises changes as you go through the recovery process. And so when you are starting out, specifically with strengthening exercises, relief-based stuff, you kind of just keep that running in the background. But strengthening work, when you're starting out, you might be playing around with a dead bug, for example, for about 10 or 15 minutes, and then you try the marching bridge or something like that, to figure out how to do the exercise without aggravation and how to do it correctly from a choreographic point of view. But then once you've done that, you might then put it into a routine. Like those are the routines that we have our members do. And you might do that daily because you're not really challenging yourself, right? You're doing 10 squats, right? Many of you guys will be able to do this, right? You go 1, 2, 3, and that might be where you're going, right? Because you can only go that low. So you do 10, then you stop, right? And if you're honest, like you could do another 10. You could probably do more than that. So that's not actually changing you. Yes, you're getting technical benefit, sure, but you're not actually building anything beyond the technique, which will happen relatively quickly. And so very shortly after that, you need to find the right intensity. And this is what we call with our discovery workouts. And so once you've found that right intensity, then your frequency of being able to work out like that is going to start dropping. So you might then do 4 or 5 sessions a week of workouts. And then over time, that might progress down to actually, you're using significant amounts of load now. You've built it up over a period of months. And now you're doing like 2 or 3 harder workouts a week. And maybe you're actually starting to feed in some other bits and pieces now so you can continue to rebuild the strength and resilience in your lumbar spine. So it changes over time. Kokoro on YouTube has said, I would advocate for using a TENS unit. Awesome. So I don't see any issue with using TENS. If it helps you, great. If it doesn't, give it back, so to speak. What have we got here? We've got some more comments coming on YouTube. I'm a taxi driver and I have little back pain while working. What should I do? It's really difficult for those of you that are like truckers, taxi drivers, or have to drive for a living because you can't really get out of the vehicle the same way in which an office worker might be able to get up from the desk, although there are some exceptions in that environment as well. So you just have to do the best you can. A couple of things. Number one, if we can get the seat to slope away so our knees are lower than our thighs, that can help support a more upright position and a more neutral spine. It's not ideal, but it's the best you can do, rather than being in the reverse, which would be a bucket seat where you're like, so, this is rounding my back terribly, not going to be helpful. The second thing is if we can get a small rolled up towel to place to support our lumbar spine, that can also help. If you're driving as a driver, you can't really recline the chair, but if you're a passenger, reclining the chair to a safe degree, obviously not too far, so you would slide out of the seat belt if you stop suddenly, but reclining the chair a little bit can also ease some of the strain on the lower back. And then you just got to do the best you can, right? If you are a taxi driver, you're going to have to do your rehab work alongside that to rebuild strength and stability into the lower back. That's the best you can do, right? Someone's looking to get an C therapy, is looking to get a discectomy this week. Definitely send us a DM because we have a podcast episode talking about post microdiscectomy, and that might be really helpful for those of you guys that are in that category. And if you're awaiting back surgery, there's also a surgery podcast. Just send us a DM if you're on TikTok and just say, hey Mike, can you send me a link to the relevant podcast, and we'll send you a link. And if you are asking for that on TikTok specifically, you have to copy the link and paste it into the browser, because TikTok doesn't allow direct links, which is really annoying. What other questions have we got here? And guys, those of you that are new on YouTube, if you've got any questions, you can always post them down in the comment section. Just going back over to TikTok, which is where you guys seem to be throwing questions at me. Lower back injury seems to have eased, but now the upper side muscles flare up. Not too sure what to say there, to be completely honest. Often the inflammation calms down. And so, actually no. So when we have a lot of back pain, we're often drawn to the major symptom, which is the pain, the discomfort that we're experiencing. And there are other sensations that are there, other stiffnesses that are there. We've been holding ourselves like this off to the side for a long period of time. And there are those sensations there, but they're not really in our present consciousness. And then once the pain starts to settle down, because the inflammation is settling down here, all of a sudden, we're like, oh, well, my back's not hurting, but actually that numbness in my big toe, that's really bothering me. It's really irritating. It's really annoying me. Because the worst thing we're experiencing right now is the worst thing we're experiencing right now. Even if we had a lot worse in the past, we become aware of that current thing. And so it's not unreasonable, especially if we're talking about maybe higher up the back. The other areas we're aware of that stiffness now, our lower back isn't bothering us quite as much. That could be what's going on there. Does inflammation on a disc injury only go away with anti-inflammatory pills? No. Your body's gonna try and calm it down. But if you keep aggravating, re-aggravating, and continually aggravating these discs because we're not actually learning to stabilize our spine and we're still moving in all sorts of manner of ways and creating these minor irritations, then you're constantly going to be re-injuring, re-flaring up that area and re-driving the inflammatory process. Appreciate that the inflammation process is a good process. It's the process by which we drive resources to the area of our body that is injured or that is inflamed or that is infected, so it can get the immune system there, etc., and drive waste products away and new nutrition to that area so that you can go through the healing process. Just medicating everything with pills is not really a targeted approach. One of the things that we do advocate for strongly is using contrast bathing over this section of the lumbar spine where we have the root cause, the injury to our lower back, because that helps manage excess inflammation in the lower back, as opposed to, because you will see a lot of people talking about using heat for injury recovery because you want to help support that inflammation process. In the knee, in the ankle, in the wrist, that's not a problem. There's lots of stretchy tissue there. The problem is in the lower back, there's these confined little holes, which are bony tubes, and they don't stretch the same. And so for a lot of people, it's actually a buildup of inflammation in that area that creates this pressure. And then they want to round their lower back, and it instantly alleviates the pressure at the cost of making the problem worse. So managing the excess inflammation with something targeted, like using ice or contrast bathing directly over the area we're talking about, can work an awful lot better. And that's just something that really has been a tremendous help to so many of the members of the program. What else we got? We got taxi driver, I hope, hopefully getting disectomy this week. Just looking through some more of the comments, guys. If you guys have any more comments on this kind of stuff, then always post down here. And if you're on YouTube, you can always do the same as well. What else have we got? What are your thoughts on dry needling? We've done that one there. My left hamstring is constantly in spasm and cramps. I'm improving so much. No back pain anymore. Awesome. That sounds like we're doing well, which is good. It's very normal if we've got an injury down in the lower lumbar spine, L5S1 or L45 just above there, to get signals being sent down into these muscles. Maybe it's the glutes, maybe it's the hamstrings. Getting signals telling them to tighten up. And a lot of people will struggle immediately with actually doing some stretching, etc. there, because quite frankly, in order to be effective at delivering something like a hamstring stretch, you need to have a strong enough midsection to not allow the spine to buckle when you start stretching, right? Because if I do a stretch, trying to do the hamstring stretch, if I lock my spine in place and just pivot at the hip, all of a sudden I get the hamstring stretch. If I come back off there and just go like that, all I'm doing is rounding my lower back. But so many of you, when you try to stretch off the hamstrings, will just be doing this. And that is not stretching the hamstring. Although you might, if you pull everything as much as possible, you might get there. It's not a strategic way of actually delivering a targeted stretch to that area that you're trying to alleviate. And the other thing to bear in mind is people then just try stretching, not realizing that actually you've got signals at this level of the lumbar spine. They keep going out to that muscle, telling it to tighten back up again. And so stretching, while we do talk about stretching in a small part of the program, in our relief-based work, it is of limited value. But what you find is that when you make progress on the strengthening front, the rehabilitation work, you rebuild strength and integrity into your lumbar spine, you find that the stretching that you are doing, the small periods of stretching that you're doing, actually then start to accumulate because you no longer have that active injury. It's actually well on its way to recovering in the lumbar spine. And therefore, there's not the same signaling or irritation of the nerves that go out to the hamstrings. So they start to tighten, so they stop tightening up between each time you stretch them, which allows you to get some momentum in the right direction. We've got a couple of questions here. When lifting a weight, I had sharp pain in the lower back. Is it a re-herniation or is it a chance to just be? Not so sure what the rest of that question was going to be, but it's very likely if you've had a sharp pain when you were lifting, take a step back and evaluate, like, were you doing it correctly? Were you trying to move the fridge or something like that? Well, that might have set you in a bad direction. Chances are you've strained or restrained some of the tissues that were trying to heal. Now, as long as you don't have, as we discussed earlier on the live, as long as you don't have, presence of the emergency sort of cauda-equina syndrome and you're just getting a flare-up of your back pain or your sciatica, well, chalk it up to experience. I did something wrong. I've had a flare. Basically, everybody that goes through the recovery process of a back injury will have flare-ups because you can't control. The biggest problem with back pain is that you can't protect your back properly or effectively from yourself. And so you're going to have flare-ups. Worrying about whether it's a significant re-herniation or a minor re-herniation or a minor strain or all that is immaterial because it doesn't change what you need to do, and you can't really know in any meaningful way. And like a couple of months ago, we had a very quirky scenario where we had a number of people messaging us in the members area where they'd recently had MRIs, and some of the people, like, it was either before joining or just after joining or something like that, and there were like 3 people that messaged, and one person was feeling better, but they had an MRI and it said the herniation was worse. The other person was feeling worse, but they had an MRI and the MRI showed the herniation was better, and the other person was like a repeat of the first one. And like, it's so immaterial. It doesn't really matter in many ways as long as we don't have those emergency symptoms and we're making progress on the rehabilitation. Yes, you're going to have flare-ups. Don't catastrophize as best you can unless you have good cause to. Like, if you just fell off a ladder onto your back, go to A&E. There's a significant trauma at play. But if you were just feeding the cat and you flared your back up, or you were just moving the fridge and it's gone back to how it was, chalk it up to experience. We need to be a bit more disciplined and try and stop doing that kind of stuff and focus on rebuilding through the rehabilitation work. That's really important. Mickey has said L5S1 in a cycle of flares, a few days minimum pain, and then a flare. Is this a sign of moving forwards? The biggest thing, I can see Mickey here on the photo on TikTok. You've got a pet dog, right? I'm assuming. So often, like, we get up in the morning, let's say we've got pets, because my mum and dad have 2 dogs. You go downstairs, maybe let them out, whatever. You go feed them. Oh, you round it down to go to the floor. You're taking them for a walk. They run after a squirrel. We get pulled off in a direction. All these other sorts of factors are there. This is, again, going back to why so many of you will have flare-ups from one moment to the next. Make sure you are progressing. You need to pin your hopes, pin your aspirations, pin your progress to your progress through the process of getting stronger and rebuilding strength and stability in your spine. Specifically on the hip hinge and the squat. One or the other of those. I would suggest both, but one can always front run the other, so that you have that objective, verifiable measure of your current level of strength and stability. And if you're still messing around with 5, 10, 15 kilos, get further on. Know you're going to have flare-ups from moment to moment until you get to a significant level. And then things happen a lot less, or they require a lot more out of the ordinary activities in order to push your back beyond a level with which it can manage and then re-irritate things. What else got? I had sciatica for 2 years, nearly 40, and walk up a hill bent over like I'm 90. It hurts when I stand up. One of the reasons that it hurts when you stand up straight is because when we have a lot of inflammation, I'll just choose a higher level so you guys can see it. When we have a lot of inflammation in these little holes here, you're often bent over like so. That means that the hole is now larger, so it will fill with more inflammation because you're doing this to relieve it, right? You're creating more space, almost like putting a bucket under a leak. So you don't know about the problem. It doesn't overflow and make the carpet wet until it fills the bucket. Well, this is the bucket. You just got a bigger bucket. So then when you try and stand back up straight, you immediately shrink the hole, and that then causes the sharp pain. The more you can avoid getting into the trap of sitting like so with a rounded lower back, the more you're going to help, and the more you do obviously the correct rehabilitation work, managing the inflammation, using things like contrast bathing, the better you're going to be at actually allowing that sciatica to calm down, because you're allowing the injury at the root cause to start to patch up, scar tissue lay down, get a little bit of baseline stability there. We shouldn't really be walking uphill. Oh no, it wasn't walking uphill, it was just walking period. A lot of people will struggle with walking period because you are just putting load on the lumbar spine. And so you walk for durations that are not aggravating. If that means you're only walking for like 5 minutes or 5 steps, that's fine. Focus on your rehab stuff. And you will notice that as you focus on the rehabilitation work, the strengthening work, your walking distance will get longer. Too many people are waiting for themselves to feel better before they move forwards with the rehabilitation work, and that is on its head. We have to get it the right way round. Otherwise, we just end up getting into a rut where we actually just don't move forwards. Just looking at some of the other comments that are coming in on YouTube. And guys, for those of you that need more help and more support, you can always check out the program on the website, backinshapeprogram.com. That's got the full program there. Right? Some of you guys are struggling quite a bit, and you really could do with some of that support. Richard has said here, I herniated my L4-5 and L5S1 10 months ago. I've stayed very active and now left with mainly SI discomfort. I can't sit for too long and I have to keep moving. I found out off my physio I have 40% strength deficit in certain isolated strength tests. I had 2 with 40% and 1 with 20. It's likely once I correct this, should I be out of back pain? I don't know what the strength tests in this sort of scenario are. And I would also say that when you are sitting, unless you're sitting like cross-legged, I'm assuming when you're sitting like so, we're getting distracted with the SIJ comment, and actually your lumbar spine is just not load tolerant. And so the most important thing you can do is rebuild load tolerance. Often people will have a discrepancy that is reasonable from one side to the other because of how we live in every day, right? Most of us, well, very few of us, when we stand in the shopping, stand like a soldier, equal distribution. We're standing on one side or the other, like so, right? And so you probably, almost all of us do, have some discrepancy, left side versus the other, in our strength, power, control, flexibility. And so that will likely be exacerbated when we have the herniation, and maybe because we're leaning on one side more than the other because of the pain. If you just focus on building symmetrically through things like the squats and hip hinges, you're going to be doing some asymmetrical exercises anyway. And as you build your load tolerance, you will find those differences from one leg to the other start to equal out anyway. And maybe you need to tidy it back up at the very end, but really focusing on, like, if you're not doing squats and hip hinges, especially 10 months after a herniation, if you're not doing squats and hip hinges on a reasonable amount of weight, a significant, like not like 10 or 15, but like a good amount of weight, that's the main area that you need to be working on. Because if we're not competent enough to do simple things like a squat or a hip hinge with a reasonable amount of weight, are we really going to be technically proficient enough to mess around doing like single leg stuff? I think it's too much. Focus on rebuilding strength and load tolerance. That gives you the most objective marker of how strong and healthy your lower back is. Kokoro said, what are the stages of recovery or feedback that helps us determine when we're healing after an injury? Very good question. There are no stages. This is why we talk about the squat and the hip hinge as being the most effective ones, because those are the two safest ways of you scaling the load that you're exposing yourself to. So maybe you started with just the body weight. Maybe you actually started with, TikTok, you guys will be able to see in a second. Maybe you started actually having to hold on to something for support and do a squat. Like maybe that's all you could do, right? Because you're really not very strong or stable. But then time goes by and you can use a 20 kilos. You can do a squat with 20 kilos, right? And then time goes by further and you can do more than that. And so that is your measure of how healed. Because it's healed for what? Healed for what precisely? Healed to carry your toddler who weighs 12 kilos? Well, if you're only playing around with 6 kilos, you haven't got there yet. You're probably still picking them up, by the way. Or is it healed to pick up a 20 kilo bag of compost for the garden? Well, if you're only at 7 kilos, you're not there yet. And if you're only at 20 kilos with a shallow squat, picking that bag of compost up off the floor is probably a little bit more precarious. And so people are so very critical about using load on their exercise and their rehabilitation where you're 100% focused on what you're doing. Maybe, hopefully, even recording yourself. Yet they won't think twice about doing all those other things. And so in terms of determining how much healing has taken place, the exercises are the greatest thing for that. They're really the most effective thing. They're not perfect by any means, but they at least give you some, finger in the air to see what you can bear safely without aggravation and whilst maintaining form. So that's really one of the great things about those kind of rehab exercises. What are the questions that we got here? My pain has come back worse than before. So one of the issues, Paul has had some surgery a little while ago, 4 years ago, and his pain has come back. So often we fail to appreciate. And guys, we've got around about 10 minutes left. So if you guys have any more questions, you please do post them in the comments. If you need more help, more support, you've always got the links in the profile page on the website, backinshapeprogram.com. And you've got to always sign up to the program if you guys do want that little extra bit of support. But use the comments as swiftly as possible, and I'll try and get through as much as I can. One of the big issues with surgery, whether it's a microdiscectomy or something more invasive, like we've got in this case, the telar fusion, often it's done and we don't have appropriate rehabilitation work. Now, excluding the scenarios where we have an emergency, it was all of a sudden we were in a car accident, God forbid this happens, it hopefully happens very, very rarely, and we had to go straight into the emergency and we had the surgery because it was necessary, right? That most people, it seems, and the amount of times recently I've had comments where people say, I've got my surgery booked in for like 3 months' time. That's not emergency surgery. And so the question needs to be in those sorts of scenarios, and maybe reflecting on for Paul. If we haven't healed this long, we've had this back pain for 5 years, it's been going on, discussions of surgery have floated about the place and we've decided we're going to book it in now. What's to make us think we're going to do any better healing from the surgery than we have been healing from the back injury? Because an invasive fusion or a non-invasive one is still going to create some tissue damage, and it does not do any healing. And unfortunately, that question is not asked and certainly not answered by either the patient or, as it more appropriately should be, the practitioner, the surgeon, the specialist. That is the question, the only question that matters, probably the most important question. And if we don't answer that question, why do we think that the person's going to do any better healing after the surgery? Because so often they're not guided, they don't have the spine stability training. When you come out, you say, do physio in like 6 weeks, you can start doing physio. What do you do in the interim between having the surgery and physio? Well, just don't do too much of anything. Walk around. It's like, so we've just done this really, really detailed surgery. I mean, all surgery is going to be detailed. And you're telling me not do too much is your advice. Don't sit too much, don't stand too much, don't walk too much, but do some walking and, don't lift anything. That's your layer of advice after we've had something that's very, very detailed. Like, that is not good enough. And then we have the physio and they go, hey, here's some exercises, go and do those. And it's like the level of like focus, intent, precision is just night and day different. Like the surgery is super, super precise, and then we've just got this follow-up that really sucks. That's not all cases, by the way, okay? But it is too many, maybe. And so the reasons that we didn't heal in the first instance before the surgery have not been addressed. So we carry on. Every time we get out of the chair, we go like this, and every time we go like this, and we haven't developed any kind of good habits. We haven't realised that our legs are woefully inadequate in terms of the weakness that is there. So we've not actually started learning how to actually move in the real world in ways that isn't going to challenge that back. We haven't appreciated or been instructed that actually now we've got one less joint. So when you are doing all of that spinal bending and twisting, more movement is going to go through fewer segments, which means you're more likely to put those under significant strain. And what's more, they're almost certainly less conditioned than they otherwise would have been 5 years ago, 6 years ago, 7 years ago. And we haven't done anything to recondition them. And so that's why these things come back again. Now, yeah, we can have the bad luck thing, right? You could break your arm one year and then break it again the next year because you just were unlucky. But a lot of times, the rehabilitation work is lacking. And I say time and time again, if you think of you getting better, your back pain, your sciatica, your injury, you getting better is like a pyramid. The foundations of the pyramid up to like here, all of this, like the 90% is your rehab and education. And if we're going to have awesome treatments, a surgical intervention, injections, whatever it is up here, that needs to sit upon good foundations. And if we don't have good foundations, then we find these things don't last. So sorry to hear that, Paul. He didn't have any care because COVID, I mean, that really messed a lot of people up that period of time. The most important thing we could do now is it's never too late to start the rehab. I think it's a Chinese proverb, the best time to plant a tree was 20 years ago, the second best time is today. I think sometimes the frustration of not getting better for so long stops people actually making the step and actually starting to get on the right path now. So we're coming into the last 10 minutes, guys. I intensely dislike this question. I'm sorry. I intensely dislike this question. Andy, or 4NDY, if you could only pick one exercise to aid recovery, what would it be? Unfortunately, or fortunately, you don't need to. And unfortunately, that's looking for like this one thing, right? And that's where all of the gimmicky stretches and things are on the internet. It's like, oh, do this one stretch and your sciatica will be gone forever. So it doesn't work like that, unfortunately. Because you're actually going to, as you get further on in the recovery process, you're going to want to give certain exercises, a break. You can't be doing squats every single day. You can't be doing hitch hinges every single day. The dead bugs and marching bridges have no load tolerance. So if I had to pick the best exercise, if I had to pick the exercise that ticks the most boxes, although it's not one, you can't just do this, the squat ticks the most boxes. Why does the squat tick the most boxes? Because the squat is something that every single person will do, no matter how bad their back is or isn't, how weak their back is or how strong their back is, whether they've just had surgery or whether they're on the Olympics, doing a demonstration of extreme levels of power and strength and resilience. So the squat is applicable to every human being, more or less. In order to perform the squat, you need to have strength and coordination, which applies to the real world because everybody is doing a squat every single day, whether formally in their exercises or not. You have to have a strong torso and midsection because if you don't have a strong core, you will buckle under the weight that you're using and you'll fall over. And so it ticks all those boxes in that regard. The squat then can be done holding onto something for support like your partner's hands at a very light depth, or it can be done with a barbell, with dumbbells to scale and increase the resistance. So it is suitable at all levels of the recovery process, which means you need to learn one exercise one time and progress on it over time, rather than constantly having to learn new exercises. So it is one of the powerhouses, literally, of rehabilitation work, but you've got to treat it with respect and learn how to do it. So it is the best exercise, but then you combine that with doing other relief-based practices like the bed decompression, the towel decompression, stretching work, massage gun work is really, really helpful. And the other exercise, the hip hinge will help knock-on effect on the squats. And sometimes, you know what, your knees, your quads are just really, really tired. So you want to transition over to focus on the hip hinge for a little bit and really refine that movement. So there's lots of different movements that are there. There's a handful of a few, right? There's not tons of exercises that you should be doing. There's a core 5 or 6 exercises that you should focus on rather than just one. I think one, not so much. Well, we got a couple of comments coming in on here. We've got Mina B has said, I have a slight lumbar lordosis based on an x-ray. Do I still have to keep a neutral spine when doing exercises? Awesome, Mina, you joined the program. That's cool. And get stuck into everything, phase 1, phase 2 immediately, and get into the members group as well. That's really, really important for sport. Okay, so with regards to the lordosis, Mina, you will see, if you go through some of the past live streams that we've done for the members, we regularly review, members will upload their x-rays, we do some analysis of it to measure their spine, and then talk about it with that individual and the members on the live sessions, because it seems to be really helpful for a lot of people. You have to actually measure these things with numbers. So everybody should have a lumbar lordosis. I don't know in Mina's case whether it's we have a slight lumbar lordosis in terms of we have a reduced lumbar lordosis, we've only just got a little bit of curve, or whether we've got a slight lumbar lordosis loss or gain. I don't really know. Numbers are what we want to look for. So do we have a 23.7% loss of lumbar curve or increase of lumbar curve? That allows us to formulate a more helpful comment. And so seeing it will be really helpful, Mina, so you can see how the members uploading theirs in the members area. And that should be helpful for you. Let me just verify I'm a human on TikTok. I failed. That's awkward. Awesome. So, yes, Mina, have a look at doing that. But one of the most important things to understand with regards to the alignment of your lumbar spine is that you're not going to verifiably change it by the way in which you move. Focus on a neutral spine. Focus on maintaining a neutral spine. What does that look like in practice? And I'm just going to turn the TikTok guys so you guys can see me stand against the wall over here. So, the best thing you guys can do is stack your hips over your feet, your rib cage over your hips, and your head over your shoulders. That's the best you can do. Because if you're tilting, you don't know how much tilting you're doing, flattening or increasing the lumbar curve. And so what that means in the real one, I'm not going to be able to do it because the vulture's in the way, but you get your heels either touching the wall or about an inch away from the wall, depending on how big your buttocks is. Your bum touching the wall, your middle back or bra strap ladies touching the wall, and your head touching the wall. And that will give you a vertical alignment. That is neutral. That's it. You don't need to be any more specific than that. And for those of you that want to see an example of changing the lumbar curve, there's one on the YouTube channel. That's the most important thing that we can do. Mina's also said, I feel the hamstring stretch is way more under my knees and below my that. What am I doing wrong? You're probably having your leg locked out. When people do a hamstring stretch and lock the leg out, it just feels all down here and in the back of the knee joint. You have to have a slight bend. Mina gets stuck into some of the tutorials that are there to help you guys get it better. And also bear in mind, it's a bit of practice. It is a bit of practice. And you should not be experiencing pain when we're doing the exercises. If you're experiencing pain while you're doing any of the exercises, you have to back off the depth. Okay? So when we're doing something like a squat, for example, if it hurts here, don't go that low. And that's, again, using a little bit of tutorials, uploading videos to the members area, that kind of stuff is going to be really important for you to actually get these things right. And I would suggest Mina playing around with those and then getting some posts done in the Facebook group on the members area will be really, really helpful for you getting that extra bit of support. Last one here from Mina said, when I engage my core due to dead bugs, I feel my middle back and upper back and hips and pelvic floor also very much engaged. That is perfectly okay. Sometimes people feel their jaw engaged. When you are learning these things, I always remember one guy used to, when he used to do the exercise, he used to literally go bright red because he was trying so hard. And the idea is you're not good at it. If you look at a child when they're first going like roller skating or walking even, you're really focusing because you're not very good at these things, but you will get better. And that's the most important thing. Through practice carefully, you will get better at these kind of movements and also like take solace in the fact that you're not very good at them, which is great because you're starting to get better at them and that's going to have a really good impact. Like the worst thing would be is like you get started on like the program, right? And you do squats and you can do the squats and the hip hinges and you can do it all. And you can do it all with your body weight on loading. And then you're like scratching your head. But everybody that comes through the program, like when they're struggling with lower back pain, with sciatica, They can't do these basic things. And maybe some people can do the basics, but then as soon as they add load, they have problems. They hit blocks. And that's great, because now you realize, actually, I'm really not very good at these dead bugs. I really struggle to actually engage my core. So is it any wonder I keep having random flare-ups for no apparent reason on a daily basis? Awesome. I think we're getting towards the end now, guys. So, last questions coming in. We've got Richard here. I've heard you say about aiming to do a certain amount of your weight in squats as a good benchmark. So 3 benchmarks for spinal loading for you guys that should really help you be honest with yourself about your current level of competence. And you should be able to hit all of these over time, not saying you'll do these right now, but they're things to aim for. Aggravation-free, meaning it does not aggravate your symptoms, whether that's pain, numbness, tingling, whatever, with correct technique. You must do all of these. And so the first milestone would be the 40% of your upper body weight. So, and the reason for this is that that's the lower margin for sitting, right? When you sit down, you put around about 40 to 90% more load through the lumbar spine. So if I use real examples for me, so you guys can appreciate this, and maybe you guys can do the maths yourself afterwards, just pause the video or something and do it yourself after this. I weigh 90 something kilos, 92 kilos-ish, thereabouts. I've probably got about 50 kilos of upper body weight on my spine. So when I'm sitting, I'm putting about 40% more load. That's 20 kilos. So 20 kilos would be my first marker. To 90% of that, which would be 45 kilos. So 45 kilos would be my second marker. And then my body weight, 100%, would be my third marker, 90 kilos. So I need to aim to get to the point where I am doing 20, 45, and then 90 kilos for 10 reps, aggravation-free on a squat or a hip hinge, without aggravation, with good form. That is the targeting that we should be aiming for. Now, obviously, you're going to hit some of those targets earlier than others, but that's what you should be looking for to demonstrate that you have a good and load-tolerant lumbar spine. And the process of chasing that goal over the period of months, it's not going to happen in days and weeks, over the period of months and years, is what will be rebuilding your back. And as you go through that process, you will notice that life gets easier, life gets less painful, etc. Okay, guys, I think we're going to please extension biased. Is the inversion table a good idea? Yoga, just a couple of quick fire ones. Yes, yoga, the inversion table is a good idea. You got to use it correctly, and you got to pair it with rehab. Sciatica, extension based biased. I'm not sure what we're talking about there, Brian. Specifically with regards to questions, so sorry I can't answer that one. Muscles in my back hurt when I'm washing up. That's because you're doing a hip hinge, Tommy. You need to rebuild strength and stability, and you might not be doing a hip hinge, you might just be bending over, in which case you're putting more strain on the lower lumbar spine, which is why it hurts. And if you're doing a hip hinge, you might be not very good at doing a hip hinge, so you get fatigued. And just like saying, if you held your arm out like that for 5 minutes, your shoulder muscles are going to get tired, right? And so you just put them down, okay? Same thing with the hip hinge while you're doing the washing up. Just stop, take a break, go back to it. But understand, you're just not strong enough. If you strengthen your shoulders, you'll be able to put your arm out like that for longer, and you'll be able to bear it for longer. How do you know when to start rehab or strengthening, such as hip hinge or squat? That is a very good question. You should start it immediately. If you're getting out of bed in the morning, if you have sat on a toilet seat in the last 24 hours or 48 hours, then you should be doing the squat and hip hinge. You should be doing your rehab. The whole point of those exercises is that people are unnecessarily, inappropriately critical of rehabilitation exercises being done carefully and in a considered manner. You need to start them immediately, because the whole point is, like, you cannot ask that question. I mean this, I'm being a bit provocative here, so please bear this in mind. You cannot ask that question if you've got young kids. If you've got like kids that are toddlers age, right? And you're like, well, I've got a bad back. When can I start rehab? It's like, you're doing way more than rehab every day with your toddlers. If you've got a dog at home, you're doing way more than squats and hip hinges done carefully. So you should start immediately. These are exercises that everybody is doing stuff that's more strenuous than this on a daily basis. Awesome. I think that's everything, guys. Hope that's been helpful for you guys. If you're watching this for the first time, I've been doing these a little bit more frequently, so please, if you find it helpful, if you're watching this after the fact, particularly you guys on YouTube, by all means, post a comment in the comment section. Keep an eye out for when we go live. I'm probably doing it a couple of times a week right now. And by all means, share this with others that could benefit from it. I appreciate the questions. I appreciate you guys jumping on live. And if you guys are finding this helpful, it's probably something that we'll keep doing for a little while longer, as long as it's helpful and as long as you guys, have questions. So thanks so much for joining, guys. And I will see you guys next time. And just a quick one on YouTube. Do you have recommendations for strengthening the leads slowly? you just do a shallower squat meter. You're getting in and out of chairs every day right now anyway. You're getting out of bed. You're doing all of that stuff. You strengthen the leg muscles, which protect the knees. We don't strengthen the knees fundamentally. You're strengthening the muscles that protect the knees. And it is the weakness in those muscles that protect the knees that fundamentally is why our back is struggling, right? It's the absence of that. So as you go through the program, go through the strengthening process, you are always looking for aggravation-free, right? And that might mean that you can only squat to here. That might be all you're doing. But that is not as low as your toilet seat. So the question needs to be, and I use this as such an obvious example because everybody does it, no matter how bad their back is, right? If you're only able to squat to here, holding onto the back of the chair, that's all you do in your rehab. But know that you're going to do worse than that in the real world every day. And you just, that's the way it is at the moment. But as you get better, you will get lower and lower. And then it's like, oh, now I'm actually able to do this without pain. Awesome. Awesome. I've built some strength. I've built some stability. Oh, and by the way, my back's doing better. And oh, by the way, my knees are too. And that just takes time. It takes time. But you focus on aggravation-free reps with correct choreography. You should not be aggravating yourself. And for all those of you that are still watching, thanks for joining us on the YouTube. Hopefully it's been helpful. If you need more help, you know where to go, backinshapeprogram.com. Check out the program, and see you guys next time. Thanks for joining.